Senators Lindsey Graham and Bill Cassidy are out with the latest plan to repeal and replace Obamacare. The bill gives states power over patient protection and authority to set insurance regulations. Area Congresswoman Debbie Wasserman Schultz calls it a nightmare.
This version would add a new horror, which is reinstate the ability of insurance companies to put lifetime caps on coverage. It would dramatically, outrageously increase the cost of health care for our seniors, like every version of this bill.
Bonnie Kaufman and her daughter fear the consequences. She is a cancer survivor and remembers when health care was unaffordable.
It wasn't until 2011 when the ACA, or the Affordable Care Act, came into being that I was able to be insured again, to sleep again, to know it would be okay.
13-year-old Emily has type 1 diabetes and worries she won't be able to afford her prescriptions in the future.
If I don't receive insulin every single day, all day, I won't live very long.
By all accounts, the financial underpinnings are not there. It will sink under its own weight.
Carlos Reyes spent years on the board of the Memorial Healthcare System in South Florida. He says while he favors pre-existing conditions being covered, the cost of the current system is unsustainable.
Financial aspects of it will mean that ultimately everyone's taxes will increase, those that have to pay and carry the load, and you can't carry it for long enough. And even when they call it there's a tax savings of some sort, it's really not a tax savings. It's not a healthcare savings because it's passed on to pharmaceuticals, for example, obviously the providers, and all they end up doing is passing it on to the patient.
Critics call the plan unworkable, but supporters say it is a chance for Republicans to fulfill their long promise to overhaul Obamacare. In Plantation, Joan, CBS 4 News.